Welcome back. We are here today taking a deeper dive into Abbott's portfolio of neuromodulation with DRG stimulation for focal pain. I'm excited to have two guests on my show today to discuss how DRG therapy has helped them overcome their focal chronic pain. But first, I would like to play an informative video courtesy of Abbott.
At Abbott, we understand the heavy burden of chronic pain. We know pain has the power to take over your life, both physically and mentally. But today, there's a novel neurostimulation technology that targets and relieves pain at the source. Proclaim DRG Therapy. The Proclaim DRG neurostimulation system is the only neurostimulation system that has been proven to provide superior and long-term pain relief for patients with CRPS 1 or 2. Neurostimulation, also called SCS, has been used by doctors to treat chronic pain for more than 50 years. Approximately 34,000 people around the world get an SCS system each year. Initial research indicated that traditional SCS systems showed only minor improvements for patients with CRPS 1 and 2. However, Proclaim DRG therapy is able to achieve targeted pain relief in difficult-to-treat areas associated with CRPS 1 and 2. The therapy works by targeting the clusters of nerve cells along the spine, known as dorsal root ganglion, or DRG. These DRG nerves control pain signals from specific areas of the body where people experience pain. Proclaim DRG therapy targets specific DRGs that are involved in a person's localized pain, providing relief for specific areas of the lower body, such as the pelvis, groin, hip, knee, ankle, and foot, and does so without the tingling sensation felt with traditional neurostimulation. In the accurate clinical study, DRG therapy was proven to provide superior and long-term pain relief to more than 8 out of 10 patients, reducing pain an average of 81.4% for participants at 12 months, and improving patient quality of life, including physical activity, sleeping habits, and overall mood. Unlike traditional SCS systems that require frequent charging, the Proclaim DRG system gives you hassle-free pain relief with a battery that lasts up to 6.5 years at nominal settings, without ever needing to charge the system. And the system is controlled using Apple mobile digital devices with upgradable technology. So Abbott's latest advancements in chronic pain therapy can be delivered via software updates without the need for surgery. In addition, you can try the Proclaim DRG system to see how well it works for you before committing to an implanted system. During the temporary evaluation, you can see whether the therapy provides meaningful pain relief while improving your ability to perform daily activities. Ready to learn more? Find a Proclaim DRG-trained physician at aboutyourpain.com. Don't wait. Ask your doctor about getting targeted relief with Proclaim DRG therapy.
As you can see, DRG is a revolutionary technology used to treat chronic pain associated with complex regional pain syndrome type 1 and type 2 of the lower body. These areas include the pelvis, groin, hip, knee, ankle, and foot. So to get started to see if you're a candidate for Proclaim DRG neurostimulation system, the first step is an evaluation with your doctor. Once your doctor determines if you are a candidate, you have the option to discuss the therapy with an Abbott representative. Step 2 incorporates a temporary evaluation where the device is tried on so you can see how well it works for you before committing to an implanted system. The trial of the therapy evaluates if meaningful relief has been achieved, daily activities have been improved, and sleep has been improved. Step 3 is the actual implant, where the system is placed under the skin with the electrodes overlying the DRG for long-term relief of the chronic pain. Now, I am happy to welcome our first guest, John Gibbons, to tell us about his experience with DRG therapy. Welcome, Mr. Gibbons.
Hi, how you doing?
Thanks for being with us. So I wanted to first ask you, what was it like living with chronic ankle and foot pain before receiving the DRG therapy?
Oh, it was getting pretty bad to the point that it's affected my work. You know, I walk 3 or 4 miles a day on my job. Just about had to quit playing golf. The yard work, it just was about to stop everything, where I was going to have another surgery.
What actually happened? How did you get pain in the ankle to begin with?
I'd broken my ankle back in 2002, and the metal, I have a plate and a couple of screws and pins that are still in there. So they were aggravating a nerve in there.
And how did you find out about DRG therapy?
Well, I was seeing you for another surgery I'd had on my back, and you introduced me to it because I was complaining that my foot was actually hurting more than my back now. So,
you healed from the back surgery, and then you were like, hey, by the way, what do I do about this?
Yeah, this foot's worse than my back now. So then we tried it, and it's great. It's been a great thing.
What I really like is that you were able to keep the surgery that you had, and you didn't have to have another surgery, which is pretty amazing.
Yes, I had put it off and put it off. I was just scared of what was going to happen with more nerve damage from being cut again, the metal taken out, the downtime it was going to cause me. So yeah, I was searching for anything.
Because your surgeon recommended taking the metal out, right, to help relieve the pain?
Yes. That's what was kind of disturbing through this, is I saw 2 different surgeons, and they both said the same thing.
Wow. Well, so it sounds like DRG improved your quality of life and relieved your foot pain. What percentage would you say the pain is at now? Is it completely relieved?
Yeah, I would say it's 95% gone.
Wow.
When I overdo, I'll feel it a little bit, but it's minimal to nothing.
And your quality of life obviously is improved if you don't have that ankle pain to think about anymore.
Yes, I mean, I never think about it anymore. I can work, play golf, work in the yard, all the things I used to do, and I never think about it. It's been a good thing.
That's an amazing impact on the ability for you to perform your daily activities and improve your quality of life.
Yes.
What would you recommend? I mean, would you recommend DRG to others living with ankle and foot pain? What would you tell them?
Definitely. Just to try it, because the week that I tried it, the pain was gone within 24, 36 hours.
Yeah, so the way the technology works is we turn it on and then it kind of washes in. It's not instant, but
right.
It takes a few hours, like you said, 2 to 3 days, and then you try it on for a week.
Yep. So after that week, I knew it was going to work. I said, yeah, let's do it.
I remember, like, sign me up, let's do this.
Oh yeah, fast as you can.
Did you have any side effects or any kind of complications with your DRG therapy?
No. I guess I had to take it easy for 4, 5, 6 weeks. Mm-hmm. I was kind of pushing it to get back on the golf course, but it's the battery's in my back and the rotation of it, and but I'm back full speed.
That's awesome.
No problems.
And you don't have to charge it, which is even better.
Right.
The fact that it just kind of turn it on, turn it off as you need, and utilize it, for that chronic pain, and it's given you over 99% relief. Can't ask for anything better than that.
Yes, and I'd never hardly change it anymore. I did for a while, just trying to push it up, push it down, just to get to the right settings. So the little iPod I have it on, I actually charged it today. It was dead. I hadn't used it in so long. But everything works fine.
That's fantastic. Well, thank you so much for sharing your story. There's many options and individualized to each patient. So contact us at Performance Pain and Sports Medicine today if you think you may want to explore this amazing therapy. Thank you again for tuning in and learning about this important life-changing medical therapy. I'm Dr. Suzanne Manzi. This is Pain Diaries. Take care of you so you can take care of business.